Hi, this is Dr. Rick Rinehart here at Cass Health Surgery Clinic, and I'm here to just talk to you a little bit about Kids ENT Month. Snoring is another issue that we get commonly asked about, and snoring is very common, but can be a sign of other issues. And so many children with tonsil and adenoid enlargement will have some snoring or mouth breathing. And if looked into a little bit further, that can be a sign of sleep disordered breathing problems, or even like sleep apnea, like you think about with an adult. And so the amount of the snoring that they're having, or just to be aware of that, is important, because some of these children might need further consultation about their tonsils and adenoids. So if you have any other pediatric ENT concerns or questions or needs, or other just full service ENT needs, feel free to give us a call at the Cass Health Surgery Clinic.